Hi, I'm Russ Hornstein. I'm a chiropractor and a student of neurology. I've been studying neurology for the last 25 years and applying that to my practice. I've been working quite a lot the last couple of years on looking at the way that chiropractors are treating joints, how we've been trained to treat joints, which is basically the same for the last 100 years. And I believe that there's probably quite a significant improvement that we can make in how we're addressing joints. One of the mechanisms that we use is what's called the high velocity, low amplitude adjustment. And that means that we're going to move the joint very quickly, but through a very short distance. So we're not moving the joint very much, but we are moving very quickly. The effect of the high velocity, low amplitude stretch or adjustment is going to create a load on the muscles that are supporting the joint. And that load is being sensed by a particular part of the muscle called the Golgi tendon organ, which is a load or a position sensor. And that very, very high acceleration and then fast deceleration with a very, very short phase of velocity has an effect on that load sensor to reset the muscle to a new length. So this is a very, very powerful tool that we can use in chiropractic. When we find a tight muscle, what it means is we can stretch it very quickly and make it relax and hopefully stay relaxed. So if someone has a joint that's tight, we can move the joint very quickly, but a very short distance, and we see magically that the muscle relaxes and that the joint moves. I think one of the problems that I'm seeing with this, and again, this hasn't changed for the last 100 years, is that the way that we're applying this towards joints is typically we'll take a joint to its end range of motion. So in other words, a joint is meant to move a certain distance and then not move any further. There's ligaments that restrict that movement beyond that point. And the space where it's moving freely is called the physiologic space. And when you move it to the end range, the very end of the joint, and then you push it a little bit further, there's an area we call the paraphysiologic space, which means that it's just beyond the normal range of motion. And what we're doing in chiropractic is we're moving the joint into that paraphysiologic space, but very, very quickly, and not so far that the joint is being damaged, or that's generally what we're thinking. And I'm not necessarily disagreeing with that, but we are moving the joint beyond its normal range of motion. Anytime we apply this tool, we are going to make whatever motion we're applying easier for the body to do. So every time we're adjusting a joint, we're actually making that joint more capable of moving further and potentially further beyond its normal range of motion. And what I would argue is that's actually having an effect on the stabilizing muscles to decrease the activity of those stabilizing muscles. We know that we definitely decrease the activity of some muscles, and I think that what that's doing is decreasing the activity of those intrinsic spinal muscles that are basically giving stability to our spine. So effectively what we might be doing is destabilizing the spine when we're adjusting it. As a countermeasure, what I'm suggesting is that the joints can be adjusted without moving into the paraphysiologic space in a very, very precise way, still resolving the tensions that we're finding around the joints, but to do so in such a way that we're bringing the joint and back to a neutral position and making the joint more capable of achieving a neutral position. So if you can just pardon the crude hand gestures, if we have two bones with muscles in between them that are holding the joints together, if we find a joint where the muscles are short on one side and long on the other side, if we apply our normal stretches, what we would be doing is taking that joint over as far as it could and then stretching that muscle beyond the normal range of motion and getting this muscle, which was very tight, to lengthen and relax. But again, what we're doing is, the question is whether we're making that muscle relax too long and then creating another imbalance or a lack of stabilization of those muscles. So what I would propose is that rather than moving that joint all the way to the end range, stretching that muscle maximally and then applying further force, if we just take the joint and let it go into the position that it's in and then stretch the joint and finish at a neutral position, then what we know is we're actually going to finish that joint at a position where the muscles that are stabilizing the joint are at the same length. And I believe that's going to have a much greater long-term effect on the function of the joint, not only allowing the joint to move about its central axis of rotation, but also allow for greater stabilization because I'm not overstretching those stabilizing muscles. So it seems a bit far-fetched how you could do that, but it actually isn't very difficult at all. It's a minor modification to adjusting. Well, in a way, it is and it isn't. Obviously, we're not moving the joint beyond its normal range, but it's just a difference in the setup. And so what I'm finding is I'm actually able to rehabilitate joints very, very quickly. So if anyone out there wants to hear more about it, I'm very happy to post more or show some details of how we're doing that. But it does feel like it's an interesting concept. I've been doing it for 2 years now, and I'm getting quite astounding results in terms of being able to rehabilitate the joint very, very quickly. By adjusting to neutral, what I'll often find is that I'll adjust, and rather than a normal way where you'd adjust and then 2 days later you'd find there's tension again, or even a day later there's tension, and having to adjust the person several times in a week, I can adjust and see the person a week or 2 weeks later, and the tension hasn't come back. There might be other things, other joints around that area that need some addressing, but when I'm adjusting to neutral, the problems aren't coming back. Now again, we'll also have to consider that sometimes you're adjusting a joint which is a compensating muscle. So if you're just removing a compensation, then yes, that tension will come back. But if we can figure out where the key issue is in terms of the joint function, and we adjust that key issue, then not only will we fix that joint, we'll also remove all the other compensations which are following on from there as well. So I'm going to post some more videos about kinetic chains and other types of compensations that are happening in kinetic chains, and also how to figure out where the key issue is. And if people are interested, I'll post some more information about how we can do an adjustment that finishes at the neutral position. So thanks for watching, and please send me some comments or some emails, and I'll be glad to say more about whatever you're interested in. Thanks for watching.